Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Balata from Roots Community Health Center reporting for the week of February 21st, 2022. As health professionals rooted in Oakland serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. After providing a COVID status update, I will try to answer the question of, are we in a new phase of the pandemic? I will touch on the governor's new plan and his announcement about his new endemic strategy and try to answer, are we endemic? Is this the new normal? First, COVID-19 updates. Sadly, we are still experiencing over 2,000 deaths per day in the United States. This is absolutely devastating. We know that this is an indicator that lags behind cases and hospitalization. So in that sense, it's not a surprise necessarily, but truly devastating and absolutely not something we can normalize, losing 2,000 people per day. So definitely still not out of the woods. And certainly with respect to pediatrics, very, very concerning. Unfortunately, the reporting and the data collection for pediatric cases, hospitalizations, and deaths is not happening for all of the states, but with most of the states reporting, we have more than 850 children who have died from SARS-CoV-2. And in the last week that was reported, that was the week of February 3rd, we lost 23 children in just that week. In the past 4 weeks, or the preceding 4 weeks, we lost 89 children. That is an average of more than 3 children dying per day from SARS-CoV-2. This is not acceptable by any stretch of the imagination, particularly not for a respiratory contagious illness, and one that we have a vaccine for. When we look at the same 4 week period last year, before we had a vaccine, there were 50 deaths, so less than 2 per day. So we really are heading in the wrong direction with our babies, despite having a vaccine for everyone 5 and up. And by contrast, in the 2021 year, there was only one report of a pediatric death from the flu. So for those saying this is like the flu, absolutely not. There is no comparison. We are losing our children. This is not something that can be normalized or minimized. Here in Alameda County, you see that total cases over the previous 14 days is coming down quite nicely. Still a fair bit higher than we were in last summer's surge, but still coming down nonetheless. This is something that we can certainly be optimistic for the near term. And hospitalizations also coming down, maybe not as quickly as we'd like to see here. Still 213 people in the hospital with SARS-CoV-2. We have 1,713 Alameda County residents who've lost their lives to COVID-19, and that is up 26 people from when I reported last week. Within Oakland is reporting 12 people since I reported last week. So amidst all of this, none of these indicators are particularly reassuring, even though they may be going in the right direction. We've kind of seen this before. We've seen cases come down, and then we've seen them go back up. And we've seen cases come down, and then we've seen some of our protections that are in place lifted, arguably prematurely, and then cases come back up, and then some people say they were caught off guard or blindsided, but I don't want us to be caught off guard or blindsided. I think that we've been through this enough times now to know that the likelihood is that we will have a summer surge that will be hopefully smaller than the winter surge, as they have been in the prior years, and then we'll likely also have a winter surge, which will probably be larger than the summer surge, unless we have some new ways of getting ahead of it, or unless COVID decides it's done with us. But to date, COVID is not done with us. So we are still dealing with COVID. Nonetheless, the governor announced what he is saying is an endemic plan that is about the so-called next phase of our response. And he is using this acronym here called SMARTER, and it stands for shots, masks, awareness, readiness, testing, education, and RX or prescription. So I'm not going to go into this in much detail. I have not been able to see the entire plan yet, but I will just say a couple things. First is that the governor saying that it is endemic does not make it endemic. I'm not going to go into too much detail about how endemic is defined, but I think that it does imply a level of stability, predictability. Of course, we can always have epidemics or flare-ups or spikes and ups and downs with things that are endemic, but endemic certainly implies that we have reached some kind of an equilibrium that I don't think we have any indications that we have reached up until this time. The other thing I'm going to say about this plan is I was very disappointed that there's not a V in it for ventilation. Ventilation and filtration is a key strategy that we are going to have to implement. We're going to have to improve our infrastructure. So when I think about the next phase of our response, yes, of course, it's vaccine, masks, testing, prescriptions. These are nothing new, but perhaps with the exception of the prescriptions. But these are not anything specific to the next phase. These are just simply the things we absolutely need to do. And so the prescriptions, yes, absolutely, that should be part of our next phase. In other words, having ample outpatient treatment for everyone. But mind you, we don't have treatment approved for everyone. Our treatments are only approved for 12 and up, and they're not widely available just yet. So going into a next phase, or saying we're going to a next phase before we have ample supply of treatment, when one of the acronym letters here is about treatment, also strikes me as maybe a bit premature. So nonetheless, this is the sort of marketing or campaign that has been announced. We know that this is sort of happening simultaneously with mask mandates being lifted. And the main thing we have going for us is that, the surge is calming down as it does. We've seen this before, we've done this before. So let's definitely not, let down our guard and assume that we won't be experiencing another surge. Let's use our time as wisely as possible while we're having a little bit of a reprieve. And what does that mean? And I think it might mean, very different things for different people. For some people, I know this means go ahead and get all your routine medical stuff done. Some people that were concerned about going into a hospital setting or clinical setting, this would be a good time. Cases are coming down over the next few weeks. Unless something unexpected happens, they should be even lower. And so maybe this is the time to plan some things that you might have held off on doing. But until then, I think the main thing to note is that what for me this plan signals is this move towards individuals will need to do their own risk assessments. They will have to not rely on anything being in place for them. So we can't rely on ventilation being good. We can't rely on other people being masked or vaccinated. Really, it's sort of every person for themselves. And if we know that and we understand that and we can do our best to calculate our own risk, then that just is what it is. And so that is sort of the task before each of us, is to figure out what our individual risk is, what is the risk of our situation, who we live with, who we go around unmasked, and so on, and then act accordingly, as I know many of us have been doing, irrespective of what acronym or what new policy is coming forward, because I think that we have all seen the ups and downs that are coming with this pandemic, and hopefully learning to kind of endure with all of these waves that we go through. And so when it comes to assessing individual risk, we know that risk is just not even. It is very different depending on if you have conditions, comorbid conditions. We know that those who are obese are definitely a much higher risk. And we know that people who are unvaccinated are at tremendous risk compared to those who are vaccinated. And so here we have the chart from the state website. The link is in the post, showing that for the week ending January 23rd, and this has been quite consistent here, that those who are not vaccinated are dying at such a higher rate than those who are. And so what we see here is about 21 deaths per million among the unvaccinated and about 2.7 among the vaccinated and 1.2 per million among the boosted. So I want to just hone in a little bit here on the vaccinated and boosted and just kind of point out that even though these look very low level compared to the unvaccinated, it's worth pointing out that those who were boosted die at less than half the rate of those who were just vaccinated with that primary series. And so we know that those who have died despite being vaccinated or even boosted may not have mounted a good response to the vaccine in the first place. Those are the people that we are unfortunately losing. But still, if you're not boosted, this is something to definitely consider, that you can cut your risk of dying from SARS-CoV-2 by more than half by being boosted. And this is certainly consistent with what we saw in the studies in the lab that show that once you have that booster, your antibody response gets back up to a level that makes us feel a little more comfortable when it comes to the Omicron. And it was really the Omicron that made our vaccines take a hit. And so, really something to consider now, especially because, as I mentioned, we can no longer really rely on some of the public health interventions that we had in place. And we don't know if more of those interventions are going to start to go by the wayside either. So we're hopeful that we'll continue to have great access to vaccination and free testing and rapid testing and N95s. But we simply don't know to what level the government is going to continue to support things now that they've decided we're going into this new phase. And so I would just suggest that each of us take some time to make sure we have enough N95s, we have enough antigen tests. And those are things that Roots is giving away, and other community health centers as well. Perhaps your own physician may have access to these things, be able to prescribe them to you. They should be reimbursable, although we've heard differing stories about how easy or difficult that might be. But start exploring those things now. Let's not wait until the next surge and start scrambling for these things. Let's make sure that there are enough for you to feel comfortable that you have the protection and strategies that you need in order to address this. And so I think the other thing I'd like to point out is that because we're moving into this phase where we can't necessarily rely on the protection of others around us wearing masks and so on, is that if you are a person who has immune compromise or you are not able to get the vaccine, I want to make sure that everyone knows about Evusheld, which is the monoclonal antibody that appears to be giving about 6 months of protection. And this is for people who can't get the vaccine because either they had a severe allergic reaction or they have an allergy to one of those ingredients in the vaccine, to where your physician has said you cannot get the vaccine, or you may be one of those people who might not mount a good response to the vaccine. So those are, again, people with immune compromise. And I'll go into that in just a little bit more detail, because what we're finding is that not enough people know about this. People who are immune compromised have been extra careful this whole time. And we've been hearing a lot of folks just worried now that mask mandates are being lifted, just worried that they didn't mount a good response to the vaccine, and that they may not do so well if they catch SARS-CoV-2. And we're worried about them too, but no need to just worry. There is actually a treatment that you can get that will provide you that protection, and it's the monoclonal antibodies, which is going to be giving you those antibodies that will intercept the SARS-CoV-2 and make it so it can't latch onto those cells so readily and make you sick. The eligibility criteria is being 12 and up. It is not to treat a current infection or for post exposure. So there's actually different monoclonals for treatment and for post exposure prophylaxis. But if you're truly immunocompromised or unable to get vaccinated, then this is something we want you to have on board before you catch it or before you get exposed. So, like now. And this is again for moderate to severe immune compromising conditions or treatments. And so those include being on cancer treatments, chemotherapy, being a post transplant, or either a solid organ transplant or stem cell transplant, and on immunosuppressive therapy. They have different time frames for these things. The link is in the post. Moderate or severe primary immunodeficiency. You'll know if you have this. This will be things like DeGeorge syndrome or Wiskott-Aldrich syndrome. Advanced or untreated HIV infection. We certainly want you to be in HIV treatment if you are positive, but this is defined as having a CD4 count less than 200 or an AIDS defining illness. And also, if you are on high dose corticosteroids, so this would be like more than 20 milligrams a day of prednisone or its equivalent for more than a couple of weeks, that's considered high dose corticosteroids, and that can suppress your immune system, so that would make you eligible. There's also a number of other medications like rituximab and other categories of medications as well. And again, please check that out if you think you may be in this category. And if anyone you care about is in this category, please let them know about Evusheld. This is something that really for anyone who is immunocompromised is being recommended. This should be decided upon in conjunction with your provider. So, kind of in summary, I do not think we are in a necessarily a new phase of the pandemic. We're kind of in an old phase in a sense where cases are coming back down. We've kind of been here before. Last year, this time, the biggest difference I would say is that we didn't have any oral pills. We had the monoclonal antibodies, but we didn't have the Paxlovid. But once again, Paxlovid is not for everyone. Those pills need to be taken within 5 days of symptoms. And so, if you are someone who's at risk, then please make sure that you have good access to testing. Get tested right away, and then you can get treated. But you really need to have a physician, because if you don't have a physician, nobody is going to prescribe this for you. You can't just go to one of these, fly by night, and you have to be careful. Please check the county website for legitimate testing sites, because we know that there's been some fraudulent ones popping up. But your own physician is who can write for these treatments or order these treatments for you. So please make sure that you have a physician. But I think my main point is that we've had these ups and downs with SARS-CoV-2. We likely will continue to. And I think it is helpful to not think, oh, this is a new phase, things are going back to normal now, because at least in our experience so far, I think that it really, when it comes, then it just makes people feel more down, more upset, more, caught off guard and unbalanced when it comes back. If we kind of try to be in denial about it. So I think what is better to do is to understand that we are heading in a better direction with cases. Soon there will be much less SARS-CoV-2 swirling around in the environment. So that means we may be able to do some things that perhaps you were putting off before. But substantively, not a whole lot has changed. The existence of these treatments is great, but if you can't get them, it doesn't make a difference. So, right now, what I would suggest doing is to use this time wisely, stock up on the things that you need, make sure that you see your doctor, get a telehealth visit, especially if you're in one of those high risk categories. Maybe you're just over 65. And if you catch COVID, you're going to want to see if you're eligible for treatment. Well, how about have a telehealth visit with your doctor now? Just a consultation, a conversation. Hey, doc, if I catch COVID and I test myself at home, can I call you and will you call it in for me right away? These are important questions because you don't want to be scrambling around when you're sick. That is not the time to be trying to find a doctor and some medication and so on. So let's just use our time wisely and make sure that we're connected, that we have good access to the things that we'll need in the event that we catch it. Being tired of this does not equal being done with this. And just saying something is endemic does not make it so. So I think we just have to continue to take it day by day and continue to make the safer choices as much as possible. And what are those? Well, a high filtration mask indoors is much better than a cloth or surgical mask. Outdoors is safer than indoors. Farther away is safer than closer together. And a shorter time indoors with others is much safer than a longer time. You're going to want to make sure that the space that you're in is well ventilated and that you wear that high filtration mask if folks are outside of your bubble or you do not know them. And of course, we are hoping that more venues will take advantage of rapid testing. It is an excellent strategy before you are going to spend time together indoors. So please consider venues that are doing the testing right before as a bit safer. It's not 100%, it's not foolproof, but it is certainly an important layer to consider. And of course, to prevent the most severe and tragic outcomes from SARS-CoV-2, vaccination and booster are still remarkably effective at allowing you to survive even in the event that you do catch SARS-CoV-2. Remember, if you don't have a primary care physician, please get one. Make sure you know how to reach them before you need treatment. Eat a balanced diet, get some exercise, some fresh air, manage your stress, take a multivitamin supplement, consider additional vitamin D supplementation, and get a good night's sleep. Thank you so much for joining us. We will see you next Tuesday at 10 a.m.